Coming to you live from Nairobi, Kenya. Welcome to Africa Focus, where we bring you news from across the continent right here on Switch TV Kenya. My name is Joel Church and our sign language interpreter is Tracy Dorcas. Start interacting with us on our social media platforms at Switch TV Kenya on Twitter and at Joel Chacha M on Twitter as well. And on Facebook, it's Switch TV Kenya. And you can also send in an SMS on 22999 free of charge. But first, here are stories making headlines.
Sudan hands out cash to ease economic crunch. Thousands in DR Congo capital defy protest ban. We begin with Africa Roundup stories.
Medical personnel opened Israel's first drive-through coronavirus testing facility in Tel Aviv. The facility is a pilot program called Check and Travel and is run by Magen David Adom Emergency and Rescue Services with the backing of the Ministry of Health. The pilot program, housed in two tents in Tel Aviv's Hayakon Park, is expected to test some 900 people who are in home quarantine and develop virus symptoms. It is not intended for or open to the general public at this stage. Israel has taken far-reaching measures to contain the virus, and the cabinet authorized further stringent workplace restrictions, tightening the limit to just 30% of workers in both public and private sectors in a bid to slow the spread of the coronavirus. Hundreds of protesters marched to Thiba 1 border crossing of the Tunisia-Libya border south of the town of Dehiba in protest against the death of a young man allegedly killed by soldiers earlier this week. Some demonstrators stressed that the protest was peaceful. This is an expression of anger against what happened in Ramada. Protesters who also complain about unemployment demanded President Kais Saied visit their region to discuss their living conditions. On Wednesday, the young man identified as Monsu Trome was shot dead while reportedly driving a truck through a military zone. Algeria Foreign Minister Zabri Bakadoum assures that there is a common willingness of Algeria and Tunisia to respect Libyan unity during a visit to Tunis, which was an opportunity to discuss the conflict tearing apart their common neighbor. Algiers is trying to relaunch regional mediation between rival camps in Libya and a conflict that threatens regional stability against the backdrop of growing foreign implications.
Moving on, Sudan has launched a social program disbursing cash to around 80% of its 42 million strong population to ease its ongoing economic crisis, recently compounded by the novel coronavirus. Living in Al-Qadra, a working-class suburb around 25 kilometers from the capital Khartoum, Yasser Mohammed Al-Noor explains the financial support was much needed but not enough to deal with the current price hikes.
Sudan has begun distributing cash handouts under an internationally backed plan to help millions cope with an economic crisis aggravated by the coronavirus pandemic. The stimulus is funded from $1.8 billion pledged by 40 countries at a conference last month in Germany as the African nations transition from 3 decades of rule under now ousted autocrat Omar al-Bashir. Yasser Mohammed Al-Noor is among those who have benefited from the handouts, part of an economic reform agreement the government reached with International Monetary Fund last month.
The amount is not enough. It is worth nothing. I received 2,500. And even though I did not suffer in receiving it, the amount is not enough to last one day and is gone the second day.
I think that this project has some advantages and many drawbacks. Among the positives of this project is that it supports poor families. The level of poverty in Sudan is known. 65% of the Sudanese people live under the poverty line, and according to the latest statistics, and perhaps because of the coronavirus pandemic, this percentage rose to 80%. The exact amount of aid dedicated to one person is 500 Sudanese pounds, equivalent to less than $4 in the market. This amount is very little for a person, and it is not enough to meet any needs.
The help is much needed but not enough to deal with the rising cost of living, said Naur, who lives in a working-class suburb of Al-Qada, about 25 kilometers from the capital Khartoum. Sudanese authorities hiked bread prices early this year, and many people still queue for hours to buy staple foods or fill their car with petrol. Anti-Bashir protests that erupted in late 2018 were originally sparked by a government decision to triple bread prices before morphing into broader calls for political change. Sudan's annual inflation rate topped the 114% mark in May, compounding the country's acute economic crisis.
It's a project that aims to help this segment of the population in facing the economic reforms head-on. In short, direct cash support has financial value which the government of Sudan is providing to the providers of households according to certain criteria.
Sudan's economic woes have been further compounded by the coronavirus outbreak, which pushed authorities to impose a lockdown on Khartoum state, including the capital, that was loosened last week.
Away from the coronavirus matters, Sylvia Arthur, a Ghanaian of British origin, gives a tour of her decolonized library that she founded in Accra to honor Africa and Black literature. With this initiative, she hopes that the Ghanaians and Africans will find pride in their literary heritage.
A small group of visitors waits eagerly at the entrance to a single-story building in Ghana's capital, Accra, looking to explore the literary treasure inside. This is the Library of Africa and African Diaspora, a passion project launched by Ghanaian British writer Sylvia Arthur. Based around Arthur's personal book collection, the library provides a remarkable opportunity to bring literature from the global Black community to a country considered a cradle of African civilization and which was once a hub of the transatlantic slave trade.
This library is dedicated to the works of African and African diaspora writers. And when we talk of African diaspora writers, we're talking about African, African American, Caribbean, Black British, European, anywhere where there are people of African descent in the world, we have their books in this library. And the reason why it's important is because I think it's very important for us as a people to know that we come from a long literary tradition.
The library was founded in 2017 when Arthur moved to Ghana after working in Europe. It was renamed and relaunched this year, welcoming its first guests again in July as restrictions to curb the spread of coronavirus were eased in the Western African nation.
It will always be important to showcase and highlight African and African diaspora writers. But I think now it's in sharp focus because of the protests that are going on, and that is a good thing from our perspective. But as I say, even after the protests are over, we will still be here.
I've never seen such a brilliant collection of Pan-African writings in my life. I've traveled across to many countries in the world. I mean, best of museums and other libraries, but I've never seen how, for the first time I'm seeing an autograph book by Kwame Nkrumah and other manuscripts for Aikwe's Ames, Beautiful Ones Are Not Yet Born.
The library boasts around 4,000 books from almost every country on the African continent. Many names will be familiar to those who have been seeing growing international acclaim for African writers such as Wole Soyinka, Chinua Achebe, Chimamanda Ngozi, Ben Okri, Mariam Ba, and Gungi wa Thiong'o. But this collection is a rarity in Africa. It also has a special collection of rare and out-of-print books, drawing historical links between the works of African and diaspora writers, and offers residence for authors from abroad. The library's aim have been made even more relevant by the Black Lives Matter protests that have swept the globe and sparked renewed debates on history and equality. Ghana, a beacon in Africa's struggle for independence, has long played a role as a hub of thought and memory for the broader Black community.
Writer. This library you pay to be a member of, but we have...
The family and colleagues of Dr. Doreen Adisa Lugaliki have finally laid to the hero to rest, who was the first doctor, or rather Kenyan doctor, who lost her life to COVID-19. The doctor was laid actually in Bungoma County in the western part of the country, and the hearts of many in the country were touched as the team of medics have played a huge role in helping the country in the fight against the invisible enemy. Kenya has also lost 2 nurses to the disease.
The best sister you can ever ask for. She loved hard. she loved hard. It is not well. It is not going to be well. All I can say is our flower has been plucked.
Well, my heart is quite heavy, I'd say that. I think given the mood we have seen here, we've lost our colleague, and for us, in these times and the circumstances, she's what you call a fallen soldier. Because it's a battle for us. This is not a war of guns, bombs. It's a war against an invisible enemy. And so it's quite sad today. All the doctors are sad, in a somber mood. We've seen even the family members. And it just brings to light what COVID-19 is doing. It has caused so much devastation across the globe.
On to other news, thousands of protesters gathered in DR Congo capital Kinshasa 4 days after 5 people were killed in banned demonstrations over the choice of a new election chief.
Police wielding tear gas dispersed thousands of protesters in the DR Congo capital Kinshasa 4 days after 5 people were killed in banned demonstrations over the choice of a new election chief. Protesters gathered in Boulevard Lumumba, one of the city's main avenues, marching around a vehicle carrying former warlord and opposition chief Jean-Pierre Bemba. The police broke up the gathering using tear gas, while men in civilian clothes threw stones at the demonstrators. Some protesters were badly hurt, falling from vehicles escorting Bemba. Security forces using tear gas also dispersed other protests in the eastern city of Bukavu and in the central city of Kananga.
I hope that the authorities who are organizing this type of operation will have understood the message of the people. I hope they do.
The marches were triggered by a decision by the National Assembly, dominated by supporters of former President Joseph Kabila, to appoint Ronsard Malonda as chairman of the Independent National Electoral Commission.
Of course, we can deplore cases of brutality, of hindrance in certain cities, certain territories, certain provinces. But on the whole, the people have been present, and I congratulate them on that.
La population a répondu présente et je l'en félicite.
Stay with us here on Africa Focus. Still to come.
2 injured in suicide car bomb in Mogadishu.
Welcome back to Africa Focus. My name is Joel Church and our sign language interpreter is Tracy Dorcas. Moving on, Somalia holds the first centralized exams for students leaving intermediate schools for high school in 30 years. The nation is painstakingly rebuilding its public education system, which collapsed when civil war broke out in 1991.
Today, it's a great honor for us to announce that the general exam of grade 8 students officially started in Mogadishu for the first time in 30 years. The total number of students who are sitting exams is 37,000, with 26,900 students from the capital. I want to remind the parents and teachers and anybody else taking part in the exams to adhere and follow the guidelines of the Health Ministry for COVID-19, including wearing masks and social distancing.
Away from that, 7 members of a family in Kisii County here in Kenya are at risk of contracting COVID-19 among other ailments owing to compromised body immune systems brought about by a disease similar to elephantiasis. The family has been left in the mercy of Samaritans during these strained economic times.
Elephantiasis, which is said to be caused by parasitic worms, is transmitted by mosquitoes and affects the lymphatic body system, and Maurice Obonyo from Karera location Kisii Central was the latest victim of the disease after his 6 children faced its wrath. Even as family members claim that the medical professions are yet to diagnose him with elephantiasis, symptoms which include swollen legs, ulceration and perpetual pain displayed by Maurice put him at zero lack of exemption. Nora Obonyo says that her children were born healthy and exhibited symptoms of the disease when they were in class 7.
Naenda hospitali, hakuna ugonjwa, naonekana, narudi nyumbani kila siku. Mpaka pesa, mpaka ng'ombe hapa mchi hiyo naenda yote, hakuna kupona.
Naomba Mungu kwamba ingawa wanakuwa wagonjwa, hawasaidie halafu ndio niko nao peke yangu.
Despite this family draining their assets in an effort to seek medical aid, their sacrifice has been in vain after they failed to raise 450,000 Kenya shillings needed for a surgical procedure to treat their son, Rafael Nyagaka.
Miguu yangu ikaanza kufura, ikaanza kutoa kama maji. Sasa ikaanzia hapo hata siwezi kutembea.
Kila jioni wanameza dawa, Panadol tu, wanalala. Wanalia usiku mzima.
Jennifer Komboka's script is not any different as she laments her misfortunes and struggles since contracting the disease.
Naanza kufura miguu. Sasa analia usiku, mchana. Mpaka saa hii hakuna mtu ananisaidia.
Dominic Obadia, a good Samaritan who donated food to the family, is appealing for assistance on behalf of the family from well wishes, which has been crippled by the disease. He challenged experts to unravel the nature of the disease to help cut down on the huge financial resources required for the medication.
Even members of the family having the same health condition, I'm appealing for anybody who is seeing this clip to come on board and help them so that they can have an operation to rectify their condition.
With the COVID-19 pandemic preying on those with underlying health conditions, this family is bearing the burden of not being able to sleep at night, filled with worry as they battle with elephantiasis. Hadia Mwasiwa, Switch TV.
Somalia's army chief has survived a suspected suicide car bomb targeting his convoy in Mogadishu. An attacker detonated a device after the convoy of the army boss fired at him when he tried to get near them.
The security staff of the Somali Army Commander, General Odawa Yusuf, Reid successfully foiled a suicide car bomb that was used by the militants. While the army prevented them from inflicting casualties on the people, we thank the security staff. They thwarted the attack after shooting bullets against the suspects seconds before it went off. According to the casualties, at least one person was killed and 2 others injured in the car bomb attack, the scene which you can see from here. The Somali army promises the people of Somalia that we will foil any attempt by the militants to kill innocent people. We will defend you and we will protect you from their blasts as we did today.
Reports now show that COVID-19 pandemic has worsened female genital mutilation cases in West Pokot County, where more than 60% of cases go unreported. However, a section of well-wishers now want the judiciary to set up mobile courts in remote areas to enable women and girls whose rights have been violated seek justice.
More than 60% female genital mutilation cases in West Pokot County go unreported, with young girls being robbed of their right to education by being forced in early marriages. The retrogressive practice is now out of control during this period where most schools have been closed following the COVID-19 pandemic. According to the survey conducted in the last 6 months by Kapenguria Theatre, a community-based organization that has been fighting against the vice using a new approach of engaging peers through theatre and songs performance, shows that lack of evidence to prove is hampering the prosecutions on FGM cases. According to the survey conducted in the last 6 months by Kapenguria Theatre, a community-based organization that has been fighting against the vice using a new approach of engaging peers through theatre and songs performance, showed that lack of evidence to prove is hampering the prosecution on FGM cases.
Kapenguria the theatre group tunatumia kusensitize kupitia mambo ya drama, manyimbo na mbinu zingine mingi kama Facebook, Instagram, WhatsApp kufikia wale.
Sisi tunatumia social medias na theater kuhamasisha ujumbe kwamba FGM si mzuri. Na
Kapenguria Theatre Group Board Chairman Mr. Francis Prince said that female genital mutilation prevalence rate in the county now stands at 74%, more than national figure of 21%.
Ambazo za mambo za ukeketaji zinaendelea na hakuna watu ambao wanaleta hiyo habari. Ni wachache, labda machifu wachache, lakini wengi visa vinaendelea na hakuna mtu na report.
So Prince cited that the cases are rampant in the county due to high illiteracy level and ignorance among girls and women about the rights, and retrogressive cultural practice have jeopardized efforts to deal with FGM cases in the region. They now want the judiciary to set up mobile courts in remote areas to enable women and girls whose rights have been violated seek justice.
Serikali kuu pamoja na washikadau wengine ambao wamekuwa wakifanya kazi, tukue macho wakati huu, kwa sababu tunajua kwamba ukeketaji iko na uharibifu mingi na inaharibu maisha ya mtoto.
Areas where the cases are rampant are said to be Kongelai, Alale, Tapach, Mosol, Cheputel, Kacheliba, Chisagon, among others. Kate Silale, Switch TV.
At the Faculty of Health Sciences at University of Witwatersrand in South Africa, 6 senior clinicians volunteered to participate in South Africa's first COVID-19 vaccine trial. The OX1 COVID-19 vaccine VIDA trial aims to find a vaccine that will prevent infections by SARS-CoV-2, the virus that causes COVID-19.
These are unprecedented times. Coronavirus is going to affect everybody in the world. We need a vaccine, and the more people get involved in finding a suitable vaccine, the better. It's very appropriate that healthcare professionals and people who are involved in the research of this environment, if they can, also get involved.
The benefit, if the vaccine works, and if I get the vaccine shot instead of the placebo, I'll be protected. So there's a number of reasons, but mostly to demonstrate that this is something that should be supported and encouraged, and that no one need be afraid of it. There has been some concern, among the lay public, but as a doctor, I'll tell you, this is nothing to be afraid of.
Is to wait for cases of COVID-19 to develop amongst the volunteers, and unfortunately that's not because we're infecting people, but rather that's the nature of the virus, that people are being exposed and becoming infected. Once we've accumulated about 42 individuals that have been infected to the virus, at that stage we'll be able to sort of unblind ourselves to see whether the vaccine actually makes a difference in terms of protecting against COVID-19 or not.
And that's where we wrap up our Africa Focus right here on Switch TV from Nairobi, which is the Kenya's capital. My name is Joel Church, and our sign language interpreter is Tracy Dorcas. Until next time, do have yourself a good time.